Hi everyone, this is Dr. Tony Setiobudi, an orthopedic and spine surgeon at Mount Elizabeth Hospital, Singapore. I will talk about bunion. I'm really sure that many of you are very familiar with bunion. Bunion is a deformity in the foot. To be precise, this deformity affects the big toe. Instead of having the big toe pointing straight out, the big toe is bent sideways towards the outer part of the foot. As a result, this creates a bump at the base of the big toe. Initially, this can be a cosmetic problem, but after a while, this can cause aches and pain, inflammation, stiffness in the joint, and difficulty with activities. The biggest culprit of bunion is high heel shoes, tight and pointy shoes. Who wear tight and pointy shoes? Women. That's why bunion is very common in women than in men. It can also run in the family. If your parents have bunion, then you have an increased risk of having bunion in the foot as well. So initially, there is a bump at the base of the big toe, and this may look ugly, but if it is not painful, this is just a cosmetic problem. And sometimes these prominent bumps create an inflammation. The joint become red, swollen, and painful. After the big toe is pointing outwards, it creates some changes in the weight-bearing area in the foot. And because of that, some areas that usually bear very little weight now bear more weight. So these changes cause the development of corn and calluses. Corn and calluses are the thick skin that develops at the base of the first or the second toes. And this thick skin can be very sensitive and painful. After the bunion has developed for some time, the joint become affected, the cartilage worn out, and the joint become arthritic and become stiff. Just by looking at the foot, the doctor can tell whether there is bunion or not. But if we want to be very objective about it, we need to do an X-ray and to measure the angle. If it is confirmed that you have bunion, the first thing you can do yourself to improve the situation is to look at your shoes. If you usually wear a tight, pointy shoes, then you may want to change to a more roomy and comfortable shoes. I'm sure this will improve your situation, especially if your bunion is not too bad. Sometimes, if it is very painful, you can apply anti-inflammatory cream in the painful area twice a day. This is to reduce the inflammation. For more severe cases, you may need to have a brace to keep your toes straight. If all this non-operative treatment cannot help to reduce the pain or to improve the deformity, then you may need to consider a surgical treatment. The surgery for bunion has a few objectives. Number one is to remove the bump at the base of the big toe. Number two is to straighten the big toe. And number three, to make the big toe muscles and tendon balance. This is the primary aims of bunion surgery. If there is an advanced osteoarthritis of the big toe, then the bones in the big toe may need to be joined together. The joint becomes stiff, but the pain can reduce significantly. You may want to see your doctor and discuss what is the most appropriate treatment for you, and if you need surgery, discuss what is the most appropriate surgical treatment that suits your situation. I hope this information is useful to all of you. Thank you so much for subscribing, liking, and sharing my video. And I also thank you for spending time listening to this video, and I hope to see you again in my next video. Bye bye.